Hello and welcome to The Unfiltered Experience with Tara and Louisa. We are two girls who speak the truth about the struggle of never feeling enough whilst growing up in a world of filters and comparison. Here we will have raw, relatable and authentic conversations to empower you on your path to self-development. Come with us on the journey of unlearning. Hey guys, and welcome back to The Unfiltered Experience. Today we are sitting with a addiction psychologist, Gabby Klepfisz. She is coming on today to talk about addiction psychology. We want to go deep into what that is, how you get into that, and I just wanted to bring somebody on. A lot of you guys know my story or like bits of my story around addiction and that being the avenue for me into self-development. And I think there's a lot of stigma around addiction itself and what that looks like and what causes that, and whether it's a moral dilemma or whether it's related to trauma or it's a disease or whatever. And so who better to speak about it but someone that works in the field? Gabby, do you want to tell us a bit about how you got into your career and how you got into psychology, and then specifically addiction psychology, just to kick us off?
Yeah, absolutely. So I started actually in law. I thought that's what I had to do, and 6 months in I realised this is not for me. But I was doing a behavioural sciences elective and I loved it, and that was very similar to psychology. So I always thought I wanted to do kind of criminal law, and then I realised it was more criminal psychology, forensic psychology. So I deferred, switched into psychology the following year, and through that I never thought I was going to work in addiction. That came later, but always thought I'd be a forensic psychologist, which is what I am qualified as, clinical and forensic. And, you know, what that means is really just the intersection of the legal system and mental health. So anywhere that those two things intersect is where forensic psychologists work. So I work for the Children's Court as well. And then the way I found myself into addiction is someone more broadly in my life was suffering with addiction, and so during my placements I sought out a drug and alcohol service, did my placement in that, and I absolutely loved it, and it really just ignited some passion in me. So when I finished my degree, I got a job back at that drug and alcohol service, and that's really what I've been focusing on. I see all kinds of mental health in private practice, but I love working with substance use and addiction because it's so much more than just what you see.
It's very common in the addiction space that people that get into it have lived experience. And I think that's obviously an asset. However, when we look at the stigma of addiction, it's very easy to stigmatize addiction when you haven't had an experience with it. And I think that can be the first point of call for someone to educate themselves around what's going on there, is when they know someone that's gone through it. And I know my family had a lot of biases before I went through my stuff. What was it like going into that addiction space, and what did you have to do from a training perspective to specialize or to find information out and treat people with addiction? Like, is there anything extra, or like, what does that look like?
Yeah, so I guess two parts to that. So because I didn't have the lived experience for myself, but seeing someone else go through it, and it was someone that I'd already known for years. So I think from the outset there, for me, there just wasn't that kind of stigma because I knew this person before the addiction, and I saw what the substance use did to them. And I think from the beginning, for me, it's always been about separating the person from the behaviour. And I think once I sought out further training, which started with a placement, and then I got a lot of on-the-job training, but then at university we got about 1 or 2 lectures on substance use, and that was it. So a lot of people don't feel equipped to work in that space unless you seek out more. So the placement was an amazing start, but then coming back and getting a job in that service, doing heaps of reading, heaps of kind of additional professional development to work in that space, I came to realise that there's so much trauma underneath it. So I think the correlation I read at the time was 80% of people with a substance use disorder have some kind of trauma. And then if you look at injecting heroin users, it's up to 90%.
Wow.
So that for me was just a light bulb moment of this isn't even about the substance. It's about everything else underneath.
It's heartbreaking when you
Yeah.
think about it. And I think like when you look at someone on the street that's using heroin or that's drug addicted, you just see the symptom of the addiction, and it's very easy to just question, oh, how did they end up there? Why would they do that to themselves? But then when you like boil it back to the core reason of this person is trying to escape what's happened to them, it's heartbreaking.
Yeah.
I remember like Gabor Mate,
Yeah.
he talks about how our prison systems are filled with broken people, you know, like people in there with drug addictions are just people that need love and psychology. What do you see, like with your experience with like the work you've done, do you see as the most common thing that people are trying to escape from, like from an emotion standpoint?
I don't know if I could even pinpoint, because it's so varied, and it ranges from, childhood. It could be, I guess, what we call in the field like little T trauma versus big T trauma. So little T trauma is like, invalidation in childhood. It's like you wouldn't classify it as a trauma according to, an assault or something like that, but constant invalidation as a child is a little T trauma that over time, that could be enough for a child. And it could go from that to, obviously abuse, neglect, body image problems can be, a huge one. Being in domestic violence situations. It can even start, very often the reason why someone starts isn't the reason they're continuing. So it can start as a social thing, trying to fit in with peers, feeling like that's a sense of belonging, but somehow for whatever reason it's taken on a life of its own. And then it kind of perpetuates itself because you've caused pain perhaps throughout the addiction, which you're then trying to avoid the consequences of. There are just so many reasons why. But I would say without a doubt there's always pain, whether it's physical or emotional of some kind.
Do you ever see clients that aren't substance affected and that have addictions that maybe manifest in different areas? Because I think this day and age, although people might not, like not everyone is substance addicted, are there more common ways that you've come across that people escape their reality that maybe we're not all aware of?
Yeah, so I mean, certainly there's behavioural addictions. I haven't worked with a lot of it, but I think at the core, a lot of it would be the same. So you can see things like, and I say addiction kind of loosely, it's not clinically an addiction, but, internet addiction, pornography addiction, shopping addiction. What we see like on a day-to-day level is people are doing the same things, but in a way that is very normalised and accepted, like, doom scrolling on Instagram and TikTok. The core of that, if you're doing it in a very detached, the way we see it as self-soothing way, it's the same as people who are using substances to detach and self-soothe. It's just not at a level that anyone is kind of saying it's problematic until it is. So, you see it with Netflix. You see it with online shopping. All of these things, we do them all every day. It's just recognizing when it's become problematic. And we're all, prone to detaching from our reality and self-soothing with these external mechanisms. Could be food.
Do you feel like, because I think with any addiction there is a phase of denial for the person that's addicted because it's working for them in some capacity, whether it's scrolling, numbing out, shopping. Do you ever see clients in that phase, or do they usually come to you further down the track when they've realised they've got something to talk about? Or if they do, like, how do you work to break that denial?
I think when I was in the drug and alcohol service, I'd probably see it more there because some of the clients were mandated. Okay. So for whatever reason, they might have been on a diversion kind of order, or it was part of child protection proceedings that they had to engage in drug and alcohol treatment. So I think with mandated clients, sometimes you get people who don't want to be there. It might not be that they're necessarily in denial, but they're not in the stage of change where they're acknowledging that the negative consequences are outweighing the positives of whatever the function of that substance is. Mm-hmm. And so we talk about the stages of change in recovery, and someone that's not even kind of wanting to change would be pre-contemplative. They're not thinking about it. So really at that point, it's just about increasing motivation And there's still amazing work you can do in that space, because the person might be open to sitting with you and listening and working with you, even if they're not changing the substance use per se. You can work on harm reduction, make it safer for the time being until they get to a space that maybe they will be willing to change it.
Do you feel like people have to hit their own version of rock bottom before they're willing to change? Like, what are those stages of change, if you want to run us through that?
Yeah, so the stages of change, so we start with pre-contemplation. So that's before you're contemplating change. Basically, it's not on the radar yet. Like, the substance use is really performing a function and the person's in that. Then you've got contemplation, which is where you see ambivalence. So the person can see there are negative consequences, but also they get something still from it. Then you move into preparation. So that might be where you're booking a therapy appointment, you're thinking about changing, but you haven't quite started. And then action is where you see people are actively changing their substance use. They're putting things in place. They might be trying new things, coming to therapy. And then once you've been in the action stage for a while, you go into maintenance. Actually, part of the stages of change is also relapse, because it's so common. And we want to set people up to understand that it's not a failure. And I always speak to my clients at the outset of therapy and say, let's speak about lapses and relapses. I'm not expecting you to do it, but I want you to be prepared, and I want you to have the mindset that if you lapse, it's okay. It's not a failure. And what you do and say next is going to be the difference between whether you get back up the next day and say, it's okay, I made a mistake, or whether you go on a binge for a few weeks because you feel like you've just ruined everything.
From what you've witnessed from being in this field, why do you think relapse is so common?
I like to think of, like, if you think about behavioural change of any kind, and I know it's so silly to put into these terms, but I think of myself in the gym. I find the thought and the act of going to the gym so incredibly difficult, and I have tried so many times. Yeah. And then sometimes I'll get momentum and then a little slip up and it'll be gone. And I know that is like the simplest analogy to put it into, but any behavioural change is so difficult and takes so much work. So if you think about the act of going to the gym versus something like addiction, where firstly it's a drug, so it's got actual effects on your brain chemistry. There is something chemically addictive about this thing you're putting into your body. Mm-hmm. And then you couple that with the trauma, unaddressed mental health issues, other socio-economic and demographic factors, marginalisation, oppression, all of those things that might be compounding why someone wants to escape their reality, abusive relationships, all of that. You really need a whole lot of factors to align to be able to make some really good changes. You need to have good support system. You need to be in a stable environment. You need to be able to commit to therapy potentially, or AA or NA or whatever that is. So there are so many things to help maintain the change, but it's not easy. And I think that's for anything, but substance use is really hard.
Yeah, I really actually like that analogy. I think that's such an analogy that we can all relate to. I'll set myself this rigid goal, and then, for example, I was like, all right, I'm getting back in the gym this week. And then this morning I thought, nah, I'm snoozing my alarm.
It's so hard to make changes.
Yeah.
Especially when whatever the thing is still serves you in some way.
And it's also a habit, like breaking a habit it's like a wiring, and it can be brought on by environmental triggers and all sorts of stuff.
And sorry, one thing I was just thinking is that very often to make changes in that space, you have to stop hanging out with people you were hanging out with, who might be the only people that are kind of your friends or circle. You've got to stop going to places potentially that you were going. Like, there are so many things you might potentially have to cut out that are familiar. Like, that prospect in and of itself might be really scary.
I remember that at the beginning of my journey, like my dad putting that to me, and that was the hardest thing to hear. But when you start to align with a new version of yourself, you attract new people, and it just happens naturally. Yeah. And so I just wanted to put that in there, because if anyone's listening to this, it's like, fuck that. Yeah. I'm not doing
No,
this.
There is hope on the other side, but I guess it makes sense why it's so scary.
100%.
So many people are like, just stop. And it's like, well, if it were that easy, people would do it. Like, That's like telling someone that's angry to just calm down. Like, if it was that easy, they would just do it.
Do you feel like, I mean, I was thinking about this question today. I don't know if anyone remembers this, but having like Happy Harold or something come into your school.
No.
We had this like giraffe come in and teach us about life education and the risks of alcohol and drugs. And I actually had a few talks like that when I was at school. And I wonder, is there such thing when somebody has trauma and a fundamental reason to escape? Is there any way to intervene? Like, is that actually possible via education to intervene before it becomes a real addiction? Or is that stuff only really helpful for people that don't have that in their history? Like, I wonder the effectiveness of education about risks with drugs when you're younger. Like, do you see that comes into play?
I think it's important, and I know that a lot of youth clinicians in the drug and alcohol sector do go into schools and there are school programs, and I'm sure that's a big part. I think that also there are so many factors that would also need to be considered. Like, you know, peer groups are a big thing when people are introduced to substances, and for many people it'll be a period of experimentation and then they just stop. But depending on what the individual's gone through, that period of experimentation, if it's with a group who are more longer term users, if there's also trauma at home, if there's other things going on, they may be more likely to not just stop. You know, if there's been addiction in the family and either there's a slight, you know, genetic component or it's just been modeled and normalized as a way to cope, that person's going to be more at risk. Mm-hmm. So I think education absolutely is important, and it might be the difference for some people, but I think for other people there are going to be other factors as well that contribute.
I liked what you explained there, sort of the difference of what happens between someone that is experimenting and having recreational drug use versus someone that becomes addicted. Do you want to go, if there is anything more to say about what is the difference between an addict and someone that's, you know, going out and going through a party phase and what's going on for them on a psychological level?
So I guess I know that AA and NA use the word addict or alcoholic. Mm-hmm. I don't use that terminology unless my clients want to, because I think inherent in that language is the idea that it's part, like it is you. And maybe that's a label that's difficult to shift, like you have to own it forever. Whereas I come from the stance of, you know, a much more psychological perspective of a substance use disorder or an alcohol use disorder, which is a mental health condition that can be treated. Mm-hmm. If people want to and find it helpful to say addict or alcoholic because that's helpful to them, I'm not going to challenge that. But I think in terms of what makes the difference, you know, someone who can't stop, it might be for a variety of reasons. Some people just can't find that off switch. Now, whether that's something biological, whether it's just because they never learned how to regulate their emotions in any other way and this thing is working for now, it's probably a combination of all of that. Whereas there might be someone who experiments, but they've got some other coping skills. They don't have a lot of stresses in their life. Maybe they don't really like, you know, the feeling, and they might find it easier to stop. It's really hard to pinpoint because I think it's really multifactorial and also very dependent on the individual. You know, there are some disorders or conditions that are more likely to lead to addictive kind of behaviours. So neurodivergence like ADHD, more likely to have substance use. And part of that might be the impulsivity, the dopamine kind of that comes from using substances. Autism is another one where substance use is heightened because the world is really hard if it's not built for neurodivergence, so sensory overwhelm, or feeling like you don't have the social script and so alcohol helps feel more comfortable, or it softens that inner critic that's there. So there are so many reasons, I guess. That was a long ramble to say there are so many reasons why someone might become more addicted over just stopping.
Yeah, that's really interesting about how certain mental health conditions can lead to excessive drug or substance use. From what I've witnessed in 12-step recovery, and that's obviously not the only way to find freedom from using drugs. But sometimes you come across people that didn't know that they had mental health conditions and self-medicated. And then when they've gotten clean, come up against a really big roadblock at some points in their recovery, whether it's, bipolar disorder or depression. It's quite interesting, like from a clinical perspective, like how do you treat and how do you know? Because on the other side of the coin, there's people that get misdiagnosed from being already substance affected. They can present like BPD or other sorts of mental health conditions. It would be so challenging from a professional standpoint to know how to navigate a client in that position. Because of your experience, you probably have a lot more insight into what might be going on. But yeah, do you want to tell us more about the sort of mental health and addiction and how that interacts with each other?
Yeah, this is actually an area I'm quite passionate about because I noticed when I was working in drug and alcohol services, AOD services and mental health services were quite siloed and they were quite separate. And so the clinicians often in one sector didn't feel comfortable working in the other, which to me is so baffling because they go hand in hand. Like, I don't know how you can treat one without the other, and that's where dual diagnosis is so important. And I know there was a royal commission into this, and there were recommendations that the two services really need to start coming together so that people can be treated as a whole person and not, here's your substance use, here's your mental health. But it is really difficult. I know a lot of, assessments for mental health, people will say, you need to be substance-free in order to be able to give a proper diagnosis because it can look like something else. If you're high or if you're coming off drugs, it can look like something very different. And diagnosis is hard enough without kind of the substance use in there as well. But I think it's so important to be able to treat them together. And that's, I guess, where I see a gap at the moment. Like, there are a lot of coaches in the substance use space, which I think is amazing. And these are predominantly, I think, people with lived experience. And there's such an important role for lived experience in this space. I think it's so incredibly useful. But the downfall I see is that without the mental health training, people are potentially only touching the tip of the iceberg, and that mental health and trauma is not being adequately addressed. And so I'm concerned that maybe the change won't be lasting if that's not being addressed as well.
Even in 12-step recovery, the trauma isn't necessarily addressed, and it's no wonder why, because it's, sponsors and people with lived experience aren't equipped to really hold that space. But there can be still quite a stigma within 12-step recovery around getting therapy or outside help. I mean, in my circles, it's not so much, but I've definitely come across people where it is a bit more taboo or seen.
It's interesting.
Yeah.
Because you're there for help.
It can come down to, and what you said earlier about how you get 1 or 2 lectures and that's it, and you had to really go after the addiction side of things to be involved in that area of psychology. And potentially, people have had experiences where people aren't trained to hold that space around substances, and so they're not equipped to support or know how to support someone with that issue. From a training perspective, what do they talk about in methods of recovery? What are the different avenues that they suggest from your perspective to treat someone?
Again, I think I feel like this is my answer for everything, but it's so dependent on the individual.
Sure.
So, you've got from lower level of, one-on-one counselling, or when I was in drug and alcohol services, there were peer support groups, which are amazing because you're with other people who have a similar experience led by a peer. Then I guess from counselling, you can go up to, inpatient detox, inpatient rehab. There are longer term, depending on private or public system, there are long-term rehabs that go for a year at a time. Obviously, that is a more kind of intense form of treatment. Not everyone needs that. There are day programs, so day habs, where you can go multiple times a week. So it really depends on what kind of intensity the person wants or needs. In private practice, I'll see people weekly or fortnightly, and we'll be working on the substance use and the mental health. Obviously, private practice has limitations in terms of, people's financial ability to access those services. But what will work for one person won't necessarily work for someone else. And I think there's this kind of misconception that rehab is the best option for everyone, but it's not always the case. The person has to want to be there. They can't be forced to be there. That's not going to be effective. They have to want to be there and see that there is some kind of gains that they're wanting out of that process and be willing to put in the work, because it has to come from within as well. You can't just say you need to go to rehab and because they're just locked away for a period of time, it's going to work.
Absolutely, because when you're in there, you think you're going to be all right, and then you come out and it's like a whole different ball game. And you can get into that sort of false sense of security when you're in there. What I wanted to ask, because I know we've discussed this previously. So obviously for me, I do an abstinence-based recovery, but I know for you, you also treat clients that isn't just abstinence-based. So do you want to go into like what are the options out there if someone was listening to this and is really turned off by a 12-step?
Yeah, I think that abstinence works for a lot of people.
Yeah.
But I think it's also important that there are services that are welcoming of people if they're not there yet, or if they never get there, which may happen. So I actually do have a lot of clients that come to reduce their alcohol use.
Wow.
Yeah, and they want to reduce it. They can see why their current level is not serving them, but they don't intend to ever stop drinking. It's a big part of their social lives, or they enjoy it, or whatever the case may be. So we work on reducing. And a lot of it is very, specific behavioral strategies of, it sounds so common sense, but, spacing out your drinks, alternating with non-alcoholic drinks, trying not to switch between wine and spirits and things like that. Just things that will help really rein it in somewhat. And some people that works. Some people that's what they need. Other people might try that for a bit and realize they couldn't do it. And then they might say, okay, maybe I'll try a period of abstinence.
It's great. Yeah, it's great to know that you've got that service, because I feel like it can be quite common that people can get carried away with their alcohol use. It may not be an addiction as such, but they may not be their best selves when they are binge drinking, and they want to implement a healthy social drinking culture into their life. And yeah, it can be quite scary when you listen to a lot of people that are like, there's a lot of information out there for people that are in the extreme, like me, like the recovery and abstinence, and nothing. It's good not to have that in my life. But yeah, that middle zone is probably not talked about as much. Do you want to talk more about that? What have you found with trends with clients like that, and how do you treat someone that's going there with that goal? Like, how do you discover for that client that they're not necessarily in that knee-deep addiction side of things, that it is just a behavioral issue?
I think that from the outset, I try and ascertain what the client's goals are, because it's never my role to push my agenda onto anybody. And I think that if the client says, I'm not interested in cutting out alcohol, then I can't be like, that's what you should do. If I can see that it might be incredibly difficult for this person to reduce, because maybe it is kind of past just some binge drinking on the weekend, and maybe that level of control isn't going to be easy, I might say, what I've seen anecdotally is that some people find it easier to have a period of abstinence first and then reintroduce alcohol slowly, rather than just trying to moderate it or cut back. But again, I've had clients say, no, I don't want to do that. I'm like, okay, no problem. Let's work with where you are at. And I think it's so important to work with someone where they're at, because otherwise we'll just miss a whole lot of people. Because if they're not at that severe end of substance use, then they might just fall through the gaps. They might just be like, well, I'm not there, so I don't need help, so I'll just keep doing what I'm doing, where they could still be reducing harm. They could still be doing some amazing work, building motivation, clarifying their values, why they want to make these changes, which I think is a really big part of the work, helping someone to see what's important to them and why they want to make the change.